Certainly health professionals are really surprised to realise that some of the stuff they see day to day are issues that may have a legal solution.
What we've seen, for example, in studies overseas as well, is sometimes having a lawyer in a healthcare facility just allows families the ability to address what we kind of sometimes call the background factors, the factors that actually affect a family's life. But they're kind of in the background. They may not be the reason you've gone to see a doctor, but they're the reason that can sometimes make you sick.
Before Health Justice Partnerships, our staff really just had to figure things out. Whether that was picking up a legal handbook, trying to navigate the system and understand legal complexity themselves, or taking a punt with the client on the best thing for them. The ability to know that you have someone down the corridor who has the expertise, has the understanding that the health practitioner doesn't have, but knowing that the health practitioner has the trust and the relationship with the person.
It does sound strange to have a lawyer embedded in one of these sort of services, but we know it makes a real impact, and we know having our staff as people that a consumer or client can trust makes a real difference then in how they feel they can open up to a lawyer to talk about some of the issues that are surrounding them that are contributing to their mental health challenges.
When you say legal, people go to crime. They might go to family, but they will not often think of the stuff of life, of money issues, of housing issues, of employment, of discrimination, as legal issues that we can deal with and that lawyers can deal with. The idea of bringing legal help into health settings is not just to privilege legal help as the thing that makes the difference, but to realise it's another tool that can be used to address complex intersecting need. So legal help will land better when there is other support for that person happening in the same space.
I'm really excited about health justice partnerships. I think we could really expand them to all areas where we know there is need.
Doing things differently is really tough. We haven't seen inequities in this country shift for children in over a decade, and we're still seeing really high poverty levels, and we're one of the richest countries in the world. I think at some stage we've got to step up and go, this is not okay. I don't have all the answers, I don't think any of us do, but we need to be thinking well outside the box. We need to be experimenting all the time, and we also need to be making sure that that experimenting is leading to something that's actually better than it was before. And I think things like the Health Justice Partnerships are an interesting, experimental and useful way of thinking, wow, we could be doing something different here. We've already got some great evidence that this looks like it's got legs. And now the question for us is, how do we take that to scale in a meaningful way?